Throughout my journey, I had to learn so much that would end up changing my perspective on the world. My journey in nursing started back in 2017 when I had to learn the basics of anatomy, chemistry, and so on. After learning all of that, I had to go to a health center to practice whatever I learned that year. We had to measure height, weight, and head circumference of children, and we had to provide health education to mothers regarding breastfeeding and whatever, because I was in the mother and child unit. All of this started to give me somewhat of an understanding on what it is being a nurse until I went to my second year. That's when things got very interesting. So in the second year, instead of a health center, we had to go to a hospital, and we had to deal with sick patients. I'll be sharing some of the memorable instances that happened. So the first one happened when I was in my second year. There was a patient that was bedridden, and we had to feed him. So my friend was giving the patient food through his tube. He had a tube that ran from his nose until his stomach because he couldn't swallow. So she gave him his food, gave him his medication. Of course, she crushed them and diluted them in water. And after that, we spent some time talking with my clinical tutor. And then suddenly, I turn up to the patient and I notice him unconscious. And then my friend noticed that he was unconscious, and she started freaking out. She thought that she killed him. So I started calling his name. My tutor started calling his name. And then I went and started shaking him. And I went straight on to check his pulse, because back then I just got my basic life support license, and I was waiting for a moment for someone to be unconscious. And so I checked, and he had no pulse. I went on to wear gloves and my gown, my medical gown. My friend already started doing chest compression. And then in seconds, the entire unit was in this room around the patient, with a crash cart, a cart filled with equipment, filled with medication that would come in handy in such situations. Nurses were everywhere. Some took off his gown, started placing stickers that were leads. These leads had metal on top that would connect to wires that would eventually connect to a monitor, and it would show us how the patient is doing, whether his heart is beating or not. That was very exciting. I went on, started doing chest compressions, and we started switching it up. My friend did some, then I did some, then some other nurses did some. We switched in order to avoid fatigue and exhaustion, because let me tell you, it's exhausting. The older nurses couldn't keep up because it was very exhausting, so they had to change again with us, and most of them were of older age. And I remember being the last one doing chest compressions when the doctor announced that the patient regained his heartbeat. And then suddenly the nurses would turn around and tell me, "Well done, you saved a life." And that's one of the happiest I've been. And then when I leave, the head nurse, who was a brilliant woman to be honest, started telling my clinical tutor that I did really well. I had the best chest compressions. Moving forward, the next year, third year in nursing, that's when things started getting even more clear. I started seeing things differently, not just the care of the patient, but nurses as well, nursing conditions. This story started when I was assigned in the pediatric intensive care unit. One day I had a patient that looked a lot like my younger sister. And the thought of her looking so much like my younger sister and being in such critical condition was a bit too difficult for me. I kept on seeing that patient as my younger sister. And she was sedated, she was unconscious, and it was a bit difficult. After a while, I went for my break, and when I came back, I noticed my clinical tutor standing there next to the patient with her father coming at visiting hours. And then suddenly, as I'm putting my medical gown, I look and I noticed the monitor. The monitor showed an abnormal heart rate, and back then I was a bit confused because that's not how it used to look when I left. And then I noticed my clinical tutor, the nurse, looking at the monitor as well, and then suddenly she goes like, "Ismaeel, start calling the nurses and come in." And she told the father to leave. And suddenly she dropped the side rails, started doing chest compressions. The patient started dying. I was in full panic mode. I went in, cleared the space so other nurses could come. In 2 seconds, everyone was in. In a tiny room, the entire staff of that ward were in. Some were giving breaths, some were doing chest compressions, some were starting up medications, and some were documenting. The doctor on call was there as well, and he was leading the team. It was very hectic. I couldn't do anything. I was so panicked. I couldn't get the thought of that girl dying, especially when she looked like my sister. It was so difficult. And I remember wanting to do something. I just wanted to do something. I didn't know what to do. I couldn't keep up. My pace was so slow. I wanted to bring some medications. I wanted to do something, but I didn't know how. I didn't have my advanced pediatric life support. They were too fast. They knew what to do. I just felt guilty. She was my patient, and I couldn't help. Luckily, her condition stabilized after a while. With a lot of drugs, she stabilized. And then we had to shift her swiftly to the radiology unit to get some scans done. And as soon as that door opened, I could see the family. I saw the mom, the father, and the older sister crying their eyes out. And honestly, I wanted to do the same. It was so intense. I feel like they could see that I was the weak link. I was the one that they could get some information out of. They just followed me, and as we were running, shifting the patient, they were running behind me and trying to get me to say something. I had no idea what to say. And the thought of seeing the mom with her eyes all red and filled with tears, it's something that I just cannot get out of my mind. After we got those scans, the doctor ordered a specific medication that has to be given as soon as possible. So, being the student, I was the easiest one to leave and go. I left, ran out, but as soon as I opened the door, the mom was there, the father was there, and the sister was there. And they held me again. The mother begged. She begged me to tell her something, anything. And I wasn't allowed to say anything. And honestly, I had no idea what to say. And until this day, I still have no idea what to say. What could have I said? That your daughter is there dying? I rushed, went back to the ward, got them to prepare the medication, and as soon as they came back, we gave her the medication. Once it was done, I got a lot of nice compliments, you did really well, but I still felt like that's all false. I felt useless, and I just couldn't get the thought out of my head. If that was my sister, I would have been useless. I wouldn't have been able to save my own sister. I was expected to do something, or at least I was forcing myself to expect that. Am I having realistic expectations from a student? I don't know. Maybe. So moving on, I started noticing a lot of things. Nurses go through a lot. I didn't get to let all of that sink. You see, both cases ended in the patients dying a couple of days after. And I didn't get to grieve those two patients, the one I saved and the one I was useless in. Both of them died. And I didn't get to grieve them, nor did any of the other nurses. We just had to keep on going. And all of that gets a bit difficult by time. You think you're doing fine, but seeing all of that death, people dying, it's not easy. We had to keep on, we had to push on, and continue our work as if nothing happened, because we have other patients to take care of. We had to keep on pushing forward so others don't have to die. One of the most important things that you learn in nursing school is that nurses are advocates. It's one of the roles that we have to do. We advocate for the rights of our patients. We stand up for them and we support them. But as I went on from hospitals and health centers, I noticed that there was no one supporting nurses. There was a lot of injustice happening. Some of them had to endure because nothing would change. One time, my clinical tutor, who was a senior nurse, told me, after I talked to her about all of this, she said, all nurses know how unfair it is. However, as soon as they get to the point where they can do something about it, they become in charge, they forget. So tell me, who's there? Who's able to change things? Another thing that's unfair is that the nature of our work is shift work. We have to be there 24 hours a day. So some come in, and then after they leave, and others come, and so on. This is really good to ensure the continuity of care for patients. However, it gets really difficult for nurses themselves. Shift work disturbs your sleep, disturbs your health, and affects it significantly, and it affects your social life. There are many events that we have to miss, many social gatherings, many things we end up not going to because we either have to work or we have to be asleep for work. One time, I had to go to work and find out that this shift we'll have one registered nurse in the entire ward, and she had the responsibility to take care of around 20 patients all by herself, which is absurd. Thank God we were there, and if we weren't there, how would she take care of all of this number by herself. Nurses face the problem of understaffing, so they end up taking multiple roles and doing the job of 2 or 3 nurses even. And that is not okay. Nurses end up feeling burnt out and exhausted because of all of this work. There's a huge need for change. Things need to change around. We need better ratios, better shifts, more support for nurses, and the list goes on. I walked a mile in a nurse's shoes, and they weren't comfortable. It's a great profession. It fulfills you. It gives you a sense of helping and feeling others the way other people don't. However, if things don't change around, I'll just end up feeling burnt out, just like many other nurses. I hope that one day this profession will get the support and the representation that it needs. That was my mile in a nurse's shoes.